Hello. Hi everyone. You're welcome once again to Creda Birthing Concepts. My name is Ruth and I'm a midwife. And today we're going to discuss minor disorders in pregnancy. So I've really sat down to look at this and I thought, well, we've got into in the stage of the broadcast, this is the time to do this. So minor disorders in pregnancy, what are they? They are little conditions of pregnancy that they're not curable. You cannot cure them, but they can be managed. They are manageable. There is loads of them, but the one that I think everybody is very familiar with is nausea and vomiting, because it looks like almost 80% of everybody that gets pregnant do have nausea and vomiting. So when we talk about nausea and vomiting, everybody knows about that one. But there are loads of them, loads. So we're going to discuss as much as we can today. So when we talk about nausea and vomiting, what is it? So when you get pregnant, the hormones that comes into play is what causes all these things to happen. So the biggest hormone that is responsible for this nausea and vomiting is what we call HCG. So when you get pregnant initially, the baby is supported or is being fed by the hormone called HCG. And it's this HCG that when you do your urine test, it tells you that you're pregnant. And that is what it does to the body. The HCG gives you that nausea and vomiting feeling. Some people will just have the nausea, that they will not vomit, which I think is worse. And some people will have the nausea and will have the vomiting. And they'll be having the two at the same time. Some people will have the vomit and not the nausea. So it's a very common thing in pregnancy that most people know. And the severe form of it, we call it hyperemesis gravidarum. That is, hyperemesis just meaning too much vomiting. So when you have the severe form of it, you can actually be admitted to hospital because you cannot keep down anything and your body just goes into dehydration and you start breaking down your body fat. It makes you go into a ketotic mode. So if you're just having nausea and vomiting, then you can try and manage it. Yeah, manage it by trying to have little sips of water here and there, have a bit of dry foods, and try and eat things like banana, grain foods, things just to help you to be able to keep up. Yeah. But if you get to that stage where you think you've gotten to the stage where you cannot do anything, you're very weak and you cannot keep anything down, anything goes in, it comes out, and it's to the point where you cannot do anything, then you have to go to A&E. If it's not too bad, that it's a bit manageable, then you can see your GP, and the GP can prescribe you with some anti-sickness or some form of antiemetics to help you to alleviate the effects of nausea and vomiting. So that is that. And the next thing that we go for is food cravings. We call it pica in midwifery terms. So you crave for certain kind of foods. And some people even they crave for clay and things that are not even food. Some people just go to the filling station, stand there and just smelling the petrol fumes because it makes them feel good. So cravings is another minor disorder in pregnancy. Normally from the first initial stages of pregnancy till you get to 12 weeks, you crave all sorts and you can only eat certain kinds of food. We encourage you to eat whatever you can keep down, because after 12 weeks, when the placenta takes over, your body has a bit of a breather from the HCG, and then you go back to normal, and now you think, okay, I can eat proper foods now. Then you can actually have a nice balanced diet. But for the first 12 weeks that you're having this nausea and vomiting, we encourage you to try and keep down as much as you can keep down. The next thing that is on my list is heartburns. Heartburns initially, when you are pregnant initially, you normally don't get that. Is what, as the pregnancy progresses and the uterus becomes a little bigger, what it does is it pushes your stomach, everything in your stomach upwards. So what we encourage you to do with heartburns is try and eat little and often, because it's pushed everything up. If you eat too much, you feel as if the food is just there and you can just feel it. And then what it does is the gases, the stomach acids, when it releases it, you feel this chesty pain in between your breast, and that is what we call the heartburn. So try and eat little and often. Some people they get a bit of relief when they drink a bit of milk product. If you're good with that, then go for it. If it gets really severe, then you have to see your pharmacist or go to the GP. They can prescribe you lactulose, or they can prescribe you. Okay, if it's severe, you can go to the GP and then they can prescribe you Gaviscon. But the I don't know, the irony about Gaviscon is if you have too much Gaviscon, the side effect is heartburn. Can you believe it? You're having it to heal your heartburn, but if you have too much of it, it gives you more heartburn. So it's really important that you take it at the times that you're supposed to take it. The next thing, and then the other thing that you have to avoid if you're having heartburns is avoid spicy food, avoid greasy food, and avoid cigarettes. If you're a smoker, then if your heartburns is really a lot and you think it's bothering you, then just stop smoking. That will help as well. Avoid greasy food, avoid spicy food, and that will help you. The next thing on here is constipation. So when you get pregnant, I think in our other videos I've mentioned a little bit about this. You need something called in your system called hemodilution, whereby your blood volume will need to increase. So if you're not drinking enough water, you realize that your body will hold on to the water. So because the body is holding on to the water and it's not giving it to the gut to be able to come into the bowels, it becomes a bit constipated. So most pregnant women do suffer with constipation. We encourage you to eat a lot of fruits. Yeah. If you're diabetic, you have to be choosy the fruits that you are going to have. Make sure that you're having fruits that are not too much sugar based. Yeah. But you have to have your fruits. Have your fruits and then increase your whole grain like Weetabixes, and try and have a lot of fluid. So increase your fluid intake. If it gets to the point where it's really, really bad, things like prune, if you can do prune juice, it will go through you quickly and then get you relieved. So if you can do prune juice, it will help with the constipation. And saying about constipation, that will lead us nicely onto hemorrhoids. When you get pregnant and you had hemorrhoids before, pregnancy makes it worse. Initially it's fine, but towards the end it becomes really, really bad. And then if you get constipation on top of your hemorrhoids, then by the time you realize you're having bleeds in the back passage and it's not good. So if you have hemorrhoids that have become very severe, you can see your GP. They can give you something called an anusol cream that will also help with it. And then as long as you're eating good fiber food to help the stool soften up and then come easily, then that will also help. So it's really important that if you have hemorrhoids or piles, you make sure that you are increasing your fluid intake so that you're not constipated, because constipation will make it worse. And the next one is swollen veins. So for some people, they get to know they're pregnant just because of the way their breasts feel. Because when you get pregnant, because of the hormones, all the veins become very tender, and you feel like when you touch your breast, you feel like, oh my God, it's going to break. It's so tender. It's all normal. It's all part of the hormonal changes that goes on. And as I said, some of them, there's not much you can do. You just have to get comfortable. That's all you can do with it. Aches and pains. So some people do get a lot of backache with pregnancy, and as the placenta embeds and things happen, you realize that you have a little bit of abdominal aches here and there. What we really advise is, as long as you're not bleeding and you can take paracetamol for it, most of you just need to rest. A good rest will just get you all over this little aches and pains. So that is all part of it. And the next one on here is the headaches. As we said earlier, if you're not hydrating enough when you're pregnant, you're going to get a lot of headaches. A lot. And it's mostly on the front. So it's really important that when you're pregnant, you keep your hydration going. So edema, when we say edema, it's swollenness. Your fingers are swollen, your legs are swollen. Initial stages of pregnancy, you don't get it. It will be, you don't really get swollenness when you're early pregnancy, but from 20 weeks onwards, and then depending on the time of season when you're pregnant through the summer, it's very, very common to see pregnant women with their feet so high up like that. What we encourage you to do is to try and elevate your feet at night, or during the day if you're sitting and you're comfortable to elevate, and make sure that when you're in the house, you're walking around. And then if possible, when you sit, keep wiggling your toes about. It can be just pushing them up and down, yeah? And then wiggle them about. It's all about circulation. So the more you drink, elevate your feet, walk, and then just give your feet a little bit of exercise. If it's just common edema, like the normal edema with pregnancy, you will notice that as you go to bed, it will be a bit swollen than normal, but in the morning when you wake up, it should be a bit better. If that is what we're dealing with, then that's fine. And then there is the other side of swelling, which is part of a condition we call preeclampsia. So sometimes if you happen to have the same midwife and you come in constantly, and one day you come in and the midwife can see that you're swollen. Sometimes you can actually see the face and the whole body feels swollen. So with this, if you've got headache problems, and then we've got epigastric pain along the sides of the rib, and then you've got visual disturbances, then it's something else. It's a condition in pregnancy. We call it preeclampsia. If your BP is raised as well and there's protein in your urine, then your midwife will point you in the right direction. But this edema that I'm talking about is just your normal edema where your legs is a bit puffy, your fingers are a bit puffy, so your ring can't fit. So that's fine. But if it's the other side of edema, then we'll have to do blood tests and other things for you. So the next thing is frequency of urination. Initial stages of pregnancy, you'll be drinking a lot, but you'll not be peeing a lot, okay? But towards the end, almost every 2 hours, you're waking up to pee. It's normal because your body is just preparing you. And you realize that from 36 onwards, that's when all this frequency of urination happens, that you're peeing almost every hour, and it's so annoying. You try to get into a comfortable position to sleep, and the moment you sleep, you need a wee. That is normal. What nature is doing is preparing your body for when the baby is born, because when the baby is born, you'll be very lucky to get 5 hours unbroken sleep. So your body, what it's doing from this frequency of urination is just training you. So from 36 onwards, you're waking up every 2 hours, 3 hours to pee, because this is how it's going to be when the baby is born. So it trains your body to this level so that by the time the baby is here, you're used to broken sleep. So you can have a bit of 1 hour here, 2 hours there, and then at the end of the day, when you put it together, luckily you've got your 6 to 8 hours sleep. So it's a normal phenomenon of pregnancy. So if you're having those frequency of maturation, then that is fine. Sometimes that can also be a sign of diabetes in the course of the pregnancy. So if you're frequenting urine and then you are testy all the time, you need to discuss it with your midwife. Okay, good. The other thing is vaginal discharges. So you notice that when you're pregnant, your vaginal discharges increases, you're discharging loads. This is normal. The vagina itself cleans itself. And by the discharges, this is how it cleans itself. So it's cleaning it to make sure that it's always at the equilibrium, at the nice condition that it should be. So as long as this discharge is not smelly, it's not stingy, or it's not itchy, you're not scratching down below, then it's fine. Okay? So increase in discharges, vaginal discharges during pregnancy, and mostly towards the end, it becomes loads. It's fine as long as it's not smelly, itchy, or giving you other problems, okay? Or it's not a sign of urine infection, then that's fine. The next thing I've got here is feeling hot and sweaty. That is also normal, okay? So pregnant women, they say they are always hot. That is normal. So if you have that, don't worry about it. And then shortness of breath. So because as the belly grows bigger, it's taking room from some of your organs. So you have to move slowly. Don't move like when you were not pregnant. You've got this heavy weight on you. So you move slowly and move cautiously. What the pregnancy hormone does, especially something called relaxin, it relaxes all the blood vessels in your system. So every ligament, everything that needs to be relaxed. Relaxing causes it to be very relaxed. So when you're moving, you move slowly. The ligaments in the bones and the pelvic and everywhere is very relaxed. So if you move too quickly or you move too suddenly, then you can cause harm to yourself. So it's really important that you move cautiously, okay? Cautiously. And the shortness of breath, although we're saying that it's a part of pregnancy, there are other forms of shortness of breath, which is not right. So if you're getting to that stage where you think, no, this is not right, it's constant, it's there every day, I can't breathe, I'm struggling to breathe, just seek medical help. Go to your GP or go to your day assessment unit so that they will check it out, get to the bottom of it, make sure that It's just ordinary shortness of breath and nothing else. Okay, good. The next one on here is mood swings. Oh my God, do we dare talk about this? So mood swings is a very normal phenomenon with pregnancy. You're happy, the next time you're sad, in the next 5 minutes you want to kill somebody, and then by the time you realize you're sitting there chatting away and laughing. It's normal. It's normal, but this is where we also give you a little bit of caution to say that if you already have mental health, underlying mental health conditions, then just see how it goes. If you think this is way more than the normal mood swings or irritation that I am getting, then please seek help. Don't just take it down as one of the pregnancy stuff. So it's really important, okay? And then worry and fears. So sometimes you worry, you're afraid something might happen. You have this feeling of, ooh, it might not go well. It's all normal. It's your brain that is playing tricks on you, and that is fine. And sometimes it can lead into sleep problems, like not being able to sleep, insomnia. And then when you sleep, you are having nightmares, you're having dreams. So sometimes it's happy dreams, sometimes it's weird dreams. People dream that the baby is already being born and it's been fantastic or it's been bad. These are all things that come to do with pregnancy. So just take it easy on yourself and then see how it goes. Forgetfulness, God, they always forget. I always call pregnant women, they've got a pregnancy brain. It's normal. Yeah, you're allowed to have that. So if you have any questions or anything that you think is going to be really important to know, if you're going through that time of pregnancy brain, just write them down. Because if you don't, you realize that you forget something very important. And it's normal. Nobody's judging you for this, yeah? It's fine. It's normal. The next one is feelings about sex. Most people, when they're pregnant, for some reason, sometimes it's not even the women, it's the men who are scared to have sex with their partners. It's fine to have sex when you're pregnant, unless you've had a history of repetitive miscarriages. Then we just say to you, just take it easy and then wait and see how things go. And then when you're very confident, then you can do it. But sex in pregnancy is safe. Unless the woman is not comfortable to do it, then you don't have to do it. Yeah? But sex in pregnancy is safe. And the other one is botulism. Botulism is excessive salivation. So where you have too much saliva. And I don't know, but this particular condition I've seen with African women. There is a lot of African women who have this condition. What I will say is treat it just like the nausea and vomiting. Have something in your mouth. Biscuit, ginger biscuit, crackers, something. So that every time you put something in your mouth, instead of the saliva collecting, the saliva just mixes with wherever you're chewing and then you swallow it back in. So I think this is what we can say with sex and all that to do with pregnancy. If you think I've left something out that you think, oh, the other thing is varicose veins. So if you have excessive varicose veins, you need to let the midwife know, because when you're pregnant, the pregnancy hormones, it causes the blood vessels to relax. So if you already have varicose veins, it's going to go worse in pregnancy. You need to let the midwife know. If it's really, really severe, then you need to go under consultant care. And the next thing that I want to add, due to the relaxing hormone causing all the ligament to be very soft, most pregnant women do suffer with something we call pelvic girdle pain. So this is where our little pelvis will come in. So when we say pelvic girdle pain, this is what we're talking about. Yeah. So this little bone that is in here, it's not a bone, it's a cartilage. It's really soft, okay? We've got the same thing hanging on all sides, yeah? So this one, when the relaxing hormone goes into this bit, yeah, this joining bit, when it attaches to it, what it does, it causes this ligament to be very, very soft. So you may have this bone moving, click, 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 when you walk, click, 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 and this is the pregnancy sitting on this bone. So it depends on how you carry your baby. Some people carry their babies forward. So if the baby overlaps on the bone, the more you move, the more painful it gets. In some people, it becomes so bad that they have to be in clutches. So see how it goes. If you start normally from 20 weeks onwards, if it's really going to be a problem, you would have noticed that pain. You can feel it there when you're walking, when you're moving in bed. It's really bad when you're moving, but it's better when you're sitting still. So what we normally encourage you to do is to get something called a pregnancy belt. If you live in the UK, you can get it from Boots, or you can get it from Superdrug. Buy it, invest in it if you're going to have more babies. So what you do is you put it around the waist, just on top of the pubic bone, to hold the pregnancy in, so that when you're walking, it's not shaking on the cartilage to make it painful. If it gets to a point where it's really, really bad, then the midwife will refer you to a physiotherapist so that they can do a few exercises with you with physio so that it can help. Okay, good. So this is where we come to the end of today's telecast. It has been minor disorders in pregnancy. So if you loved it, share it, tell somebody about it, subscribe it, and then the next time we come on there you go, the bell comes on, and then you listen to whatever we have in store for you. So it has been me, Ruth Nyako, coming to you from Crida Birthing Concepts. Thank you for watching.